Larynx, there are some questions asking the muscles and nerve supply. And nerve supply to what? Nerve supply to laryngeal mucosa and also the muscles of larynx and cartilages of larynx and location of larynx. You mean to say anatomical location? Yes. Which vertebra related? That kind of questions. So there is a question on that. Let us see. Means everything combined into one? Yes. Smart play by the examiner. See. Larynx false. Yes. 9 cartilages. I think yes. 3 paired, 3 unpaired. Yes, that is correct. Okay, if you say that is correct, fine. What about choice 2? If it is adult male, no problem. But if it is a female, slightly higher. If it is an infant, more higher. In an infant, it can reach as high as C1 vertebra, atlas vertebra. So you're telling that this is true for adult male? Yes, not for a female. Female, it is higher. And for infant, especially while swallowing, it can be as high as atlas vertebra, C1 vertebra. So should I take this as correct option or not? That will depend upon the fact that what is the other options are. Then what is the other option? Let us see. See, 9 cartilages is correct statement. 3 midline, so they are unpaired. And 3 paired. We'll see that in a diagram. And what about the choice B? It can be a true statement in adult male. Let us take it as, see, if nothing is mentioned, always consider it as adult male. Otherwise, they would have said female or infant. So this is adult male, assumed, presumed. Yeah, maybe you can do that. But this is wrong. That is the answer. Why this is wrong? Why this is the answer? Because external laryngeal nerve supply only one muscle of larynx, which is called cricothyroid, a tensor of vocal cord. You're telling external laryngeal nerve supply only one muscle of larynx, is cricothyroid, the tensor of vocal cord? Yes, otherwise all the larynx muscles are supplied by recurrence laryngeal nerve. So all larynx muscle are supplied by recurrent laryngeal nerve except one. Yes, that is cricothyroid, a tensor of vocal cord. So that is wrong statement. That is the answer. Yes, that is a wrong statement. That is the answer. Keep the answer. And look at the 3 unpaired cartilages of the larynx. They are in the midline. This is the anterior view of the larynx, and you can see the posterior view of larynx also later. So first the anterior view of larynx, then posterior of larynx later. Yes, what is the anterior of larynx showing? 3 unpaired cartilages in the midline. If you say there are 3 unpaired cartilages in the midline, who are they? There's a lid over the larynx, that is epiglottis. Lid over the larynx, epiglottis. What is the second one? It is the thyroid cartilage, the largest cartilage of the larynx. And what is the third one? It is a midline cartilage, which is the cricoid cartilage of the larynx. Okay, fine. I think this cricoid cartilage is a ring-shaped cartilage. Yes, it is ring-shaped cartilage, one of the AIMS question. It is not only seen anteriorly, but it is also seen posteriorly. Okay, it is also seen posteriorly, but it is one in the midline. Yes, it is one in the midline. Okay, then what about the 3 paired cartilages? You can see them from the posterior view of the larynx. And when you see the posterior of larynx, I see 3 paired cartilages. Who are they? Let us name them. They are a pair of arytenoid cartilage, and on that a pair of corniculate cartilage, on that a pair of the cuneiform cartilages. So 3 plus 3 6 plus 3 9. You mean to say 3 on this side, 3 on that side, 3 plus 3 6 plus 3 9 here. Yeah, total 9. 3 unpaired in the midline and 3 paired. If you remember, we have discussed all the respiratory tube is hyaline cartilage with a few exceptions. Can you tell me the exceptions which are elastic cartilages? And you remember, epiglottis is elastic cartilage. If you say epiglottis is elastic cartilage, then who else is? Tip of the arytenoid and the cuneiform corniculate. Then who is the hyaline cartilage? The thyroid cartilage, cricoid cartilage, most of the arytenoid cartilage is hyaline cartilage. So respiratory tube is hyaline cartilage. Yes, with some exceptions. Thyroid cartilage is hyaline cartilage. Cricoid is hyaline cartilage. Arytenoid mostly hyaline, but tip of the arytenoid is elastic cartilage along with corniculate cuneiform, and also epiglottis is elastic cartilage. Remember, these are some questions you have to be careful about. And now we are looking at the side view also. Side view, yes. Why are you looking at side view? Just to have some orientation. This is the lid over the larynx, which is called as epiglottis, and the thyroid cartilage is seen anteriorly in this section, not posteriorly. Then who is seen posteriorly? Posteriorly, what you see is the cricoid cartilage. Why cricoid cartilage posteriorly? Because the cricoid cartilage is a ring-shaped cartilage. So cricoid cartilage, ring-shaped cartilage, that is why it's seen posteriorly. Yes, otherwise thyroid cartilage is seen only anteriorly. You cannot see it posteriorly. Okay, like that. Then who is seen posteriorly? Posteriorly you have arytenoid cartilage and corniculate, and over that cuneiform posteriorly. Okay, but posteriorly can you see cricoid or not? Yes, you can. And what else do you see here? That is the lid over larynx. Who is this lid over larynx? That lid over larynx, you know, elastic cartilage, epiglottis. Okay, if you say so. What is this? This is the vocal cords. And some muscles will open, some muscles will close. Why you want to open the vocal cord? To breathe. To breathe. If you want to breathe, you have to open the vocal cord. And why will you close? To make sounds. Make sounds. You want to make sounds. You open because you want to breathe, take the air in, and then you move it, modulate. By modulating, you can produce sounds. You are producing sounds. Larynx, sound box. Okay, who is abducting the vocal cord then? Who is abducting the vocal cord? That we have to find out. Larynx muscle. Now, as you talk about the larynx muscle, abductor, adductor, who are they? Let us see. This diagram will show you a muscle connecting cricoid cartilage with the thyroid cartilage lateral view. The larynx muscles are named according to the cartilages they are connecting. So simply cricothyroid muscle. The cricoid cartilage is attaching to thyroid cartilage, so cricothyroid muscle, and this is the lateral view, and this is a tensor of the vocal cord. If you say this is the tensor of vocal cord, fine. What is it going to do? Increase the pitch of the voice. That is what it do. Okay. Then you have taken a sagittal section. Yes, but before you look at the sagittal section, look at the posterior view of the larynx. Posterior view of larynx. Yes. What do you see? Posterior view of larynx. Posterior cricoid muscle. Why would you say posterior cricoid? Because attaching the cricoid cartilage and the arytenoid cartilage. So you are telling that there is some muscle on the posterior side of larynx. Yes. Attaching this cricoid cartilage with arytenoid cartilage. Yes. What is it doing? This is the safety muscle of larynx. Why would you say this is safety muscle of larynx? I will say this is safety muscle of larynx because this is the only abductor of the vocal cord. It will help us to breathe by opening vocal cord. So help us to breathe opening vocal cord. What if it is paralyzed? If it is paralyzed, then you will have difficulty breathing because vocal cord will be closed. Can we discuss more about that? Yeah, we draw a diagram, then we discuss. But it is a safety muscle of larynx. What other muscles you have? There are many, but we will focus upon some of them. Like which one you will focus upon? You will focus upon thyroidnoid also. What about thyroidnoid? See, this is thyroidnoid. If you say this is thyroidnoid, I think coming from thyroid cartilage anterior, arytenoid cartilage posterior. Yes. Thyroid cartilage anterior, arytenoid cartilage posterior. What is thyroidnoid doing? Thyroidnoid is a relaxer of vocal cord. What is that? Relaxer of vocal cord. So these are some things which we have to discuss, and you have to orient yourself to the diagram also. Why? Because examiner these days give you diagrams writing A, B, C, D. This activity done by which muscle? So you should have orientation. Like this one, yes. I am telling you, this is the muscle which is here. Actually, it will be like this. You mean to say coming from thyroid cartilage anterior to the arachnoid cartilage posterior? Yes. This muscle which will come from the thyroid cartilage anterior and the arachnoid cartilage posterior. Thyroid arachnoid? Yes. It has a inner part called vocalis. So vocalis is the inner part of thyroarytenoid muscle for relaxing the vocal cord. But remember, when you say it is relaxing the vocal cord, understand only the posterior part is relaxer. Anteriorly it is a tensor. Oh, thyroid arachnoid has two parts. Yes. Coming from thyroid cartilage anteriorly here. This is thyroid cartilage anteriorly. Yes. And that is arachnoid cartilage posteriorly. Yes. That's why the name is thyroid arachnoid. Okay. Thyroid cartilage anteriorly, arachnoid cartilage posteriorly, thyroid arachnoid muscle. And it has an inner part which is called vocalis. And it is telling, you are telling, thyroid muscle anteriorly is a tensor. I think anteriorly it will work with the anterior muscle. Cricothyroid muscle, yes, cricothyroid muscle, tensor. And posteriorly it is a relaxer, yes, relax the vocal cord. Okay. What is this posterior cricoid muscle doing? Posterior cricoid is the safety muscle of the larynx, the most posterior muscle in the larynx. So posterior cricoid is the most posterior muscle in the larynx, yes. Okay. And what is posterior cricoid doing? It is abductor of the vocal cord. What is the lateral doing? Lateral means lateral cricoid, yes. If you say lateral cricoid, then it is ADD, adductor. ADD, adductor. Remember, most of the muscle in the larynx are ADD adductors. Close the vocal cord. Only one abductor is there, safety muscle. So almost all the larynx muscles are ADD adductor, but only one abductor. Who is that? The most posterior muscle in the larynx. Who is that? That is the posterior cricoid. You mean to say lateral is ADD adductor? Yes, it is. Why it is called cricoid? Cricoarytenoid. You mean to say attaching cricoid bone with arachnoid bone? Yes. Cricoarytenoid cartilage muscle. Okay, fine. This is the thyroid you were talking about. Yes, thyroid. And when you were talking about this thyroid, you told that it is the anterior part which is tensor, yes, and posterior part is relaxer, yes, thyroarytenoid muscle. This you remember. And what is lateral cricoid doing? ADD adductor. What is posterior cricoid doing? AB abductor. What are the other muscles doing? ADD adductor, only one abductor. Posterior cricoid? Yes, safety muscle of larynx. This is the orientation. You must know these diagrams from all the direction. Lateral view and sagittal view and posterior view and transverse section also. Transverse section also? Yes. Why? Because questions are coming. So transverse section now. Yes, transverse section. You are telling this man is sleeping. Nose anterior? Yes, nose anterior. And this is right ear posterior, not posterior, to the right side. Or right ear to the right side. Yes, right side. And transverse section of the larynx. Yes, transverse section of larynx. What is this anterior most cartilage? The anterior most cartilage must be the thyroid cartilage. Now if you say this is the anterior most thyroid cartilage, fine. What is the ring shaped cartilage? Ring shaped cartilage cricoid. And what is this? This is arytenoid. What is arytenoid doing? Arytenoid is the one which is helping to open and close the vocal cord. So you are seeing here, vocal cords are closed now. Yes, closed now. You will have difficulty breathing now. So vocal cords are closed now. Yes. Who is closing the vocal cord? A double D adductor. And who is the A double D adductor? Almost all the larynx muscle. Yeah, almost all the larynx muscle. Which one they are showing here? I told you. Lateral cricoarytenoid muscle. So lateral cricoarytenoid muscle is the A double D adductor. What is it doing? It is moving the arytenoid process in such way that the vocal cord will shut and breathing can stop when you are say coughing and sneezing and parturition and defecation and urination, really, yeah, many places, while speaking also. Okay, A double D adductor, yes. Who is the abductor? The safety muscle. Who is the safety muscle? The posterior cricoarytenoid, the most posterior muscle. So it is the most posterior muscle, posterior cricoarytenoid. Here, yes. Okay, what is it doing? What is it doing? It is moving the arytenoid cartilage, and when it is moving the arytenoid cartilage, it is contracting and moving the arytenoid cartilage. What is happening? See what is happening. Vocal cords are open now. So vocal cords are open because posterior cricoarytenoid is moving some arytenoid cartilage. Yes. Okay. Fine. What if the posterior cricoarytenoid is paralyzed? If bilateral paralysis of posterior cricoarytenoid, larynx will close. The vocal cord will come to cadaveric position. And when they come to cadaveric position, there will be difficulty breathing. And you might need the tube into trachea to save your patient. Tracheostomy, tube. Safety gone? Yes. Can we discuss it again? Yes, we will discuss it again now. Here. So you're talking about the larynx muscle now? Yes, larynx cartilage and larynx muscle. And tracheostomy also. Okay. What are we looking at? Anterior view and posterior view of the larynx. Anterior view and posterior view of larynx. Yes. Okay. What do I see in the anterior view of larynx? The three midline cartilages. Which one? Front view of the thyroid cartilage and front view of the cricoid cartilage and front view of the lid over the larynx, which is called epiglottis. So these are the three midline cartilages. Yes, unpaired cartilages. So lid of the larynx, epiglottis, yes. Front view of the thyroid cartilage and front view of the cricoid. I think cricoid cartilage is a ring-shaped cartilage. Yes, it is ring-shaped cartilage. That is why it is seen anteriorly as well as posteriorly. Can I see the posterior view of larynx now? Yes, why not? You will see that there is a pair of arytenoid cartilage and there is a pair of corniculate cartilage and there is a pair of the cuneiform cartilage also. Okay, so three on each side. Oh, you mean to say a pair of arytenoid, corniculate, cuneiform. 3 plus 3, 6? Yes. Plus 3, 9. Yes. 9 cartilages. Yes, in the larynx. And what are the muscles? Muscles are named according to the cartilage they are connecting. So tell me the name of this muscle on the anterior side of the larynx. Name of this muscle which is on the anterior side of larynx. I think this is the anterior cricothyroid muscle. Yes, cricothyroid muscle, which is a tensor of the vocal cord and it is increasing the pitch of the voice. Tell me which of the two sexes have a high pitch voice. This is the cricothyroid muscle attaching cricoid thyroid cartilage. It is a tensor of the vocal cord, increasing the pitch of the voice. Tell me which of the two sexes have a high pitch voice. I think female. Yes, female. Now I have a question. Females have high pitch voice. Fine. A male want to sing in female voice. What should he do? Male want to sing in female voice. Yes. What should he do? He will train his cricothyroid muscle for 1 year. And after 1 year, you can also sing in female voice. So male has to train cricothyroid muscle for 1 year, then he can also sing in she voice. Yes. Do you know any male who can sing in female voice? This one. Who is this? Sam Smith. Who is Sam Smith? You don't know Sam Smith. Sam Smith is singing, writings on the wall for James Bond movie, which is Spectre, and I was listening to that. So I thought there are two people singing, male and female, but there was only one person. How come? Because he is capable of modulating his voice using cricothyroid muscle. Nobody likes that. What? Male singing in female voice. So flop song. Why flop song? I thought all the James Bond songs are hit songs. Yeah. There are around 23 theme songs for James Bond movies. All are super duper hit, but this did not become. It could not become as hit as the other. So this was the 24th movie. Yeah, there's 25th also coming next year in the month of December. Oh, you have all that information? Yeah, I have. Okay, what is the discussion going on? I am telling you, this man has the capability to sing in female voice using cricothyroid muscle. Do you know any female who can sing in male voice? Female singing in male voice, yes. Oh, yeah, Usha Utthap. And when you're talking about Usha Utthap, can you tell me which muscle she is using? Because she has to relax the vocal cord to sing in male voice. Who is the relaxer of vocal cord? Do you know? Posterior part of thyroarytenoid muscle. You remember? Posterior part of thyroid. So she's using posterior part of thyroid since childhood. She was a fan of English singers, so she trained herself like that. Her voice is very sweet, and she can sing in male voice also, very heavy voice and low voice also. So that is a talent actually. Anyway, let us come back to our diagram. So we have to finish off our diagram, and as we are talking about our diagram, which muscle did the singer use? Which one? Who? The Usha Utthap. Usha Utthap. Usha Utthap was using thyroarytenoid muscle. If you say it is a thyroarytenoid muscle, can you show the muscle in the diagram? Yes, of course. It is here. If you are drawing the muscle, it will be like this. Because the muscles are named according to the cartilages they are connecting. You mean to say thyroid cartilage connecting with arytenoid cartilage, so thyroarytenoid muscle, and it is the posterior part which is a relaxer of the vocal cord and not the anterior part? No, because anterior part is a tensor, and that is working with the anterior tensor, which is the cricothyroid muscle there. Yes, now you know the two tensors of the vocal cord. Who are they? Cricothyroid muscle is a tensor of vocal cord, and the anterior part of the thyroarytenoid muscle is also tensor. Then who is the relaxer? Posterior part of the thyroid muscle. Then who is the abductor? Abductor, yes, the most posterior muscle of the larynx. And who is the most posterior muscle of larynx? Most posterior muscle of larynx, you know, posterior. What? Cricoarytenoid muscle. If you say it is a posterior cricoarytenoid muscle, I think this is the one which is called as the safety muscle of larynx. Yes, it is a safety muscle of larynx because this is the only abductor of vocal cord. If you say this is the only abductor of vocal cord, then who is the adductor? Almost all the other muscles are ADD adductors, but there is only one abductor, which is the posterior cricoarytenoid muscle. It is called safety muscle of larynx. But why it is called safety muscle of larynx? Because open the vocal cord to help you breathe. And what if it is bilaterally paralyzed? Vocal cord will shut down, cadaveric position, and difficulty breathing. Why? Larynx closed. So might be required tracheostomy now. And this information is there with the anesthesia department. So that's why they are taking a precaution. What precaution? See, when you give general anesthesia, yes, you use muscle relaxants, yes. They'll relax the skeletal muscle, yes. They relax the posterior cricoarytenoid, the safety muscle also, yes. Then the larynx will be closed. How will the patient breathe? You are giving general anesthesia. Yeah. Using muscle relaxants, right? They'll relax the skeletal muscle, including posterior cricoid muscle. Yes, the larynx will be closed. How will you let the patient breathe? You should put a tube into trachea. You mean to say tracheostomy? No, not tracheostomy. You already have put a tube into trachea. It is called endotracheal intubation. So it is an essential prerequisite before you use high dose of muscle relaxant. You must have put a tube into trachea, which is endotracheal intubation, before you start using high dose of muscle relaxant. And what if I don't put a tube into trachea? Then you are not an anesthetist. You are some new house surgeon who have come there just for fun's sake. Don't do some funny things. Sir, how to save the patient? Save the patient, take a tube and put from outside. Tracheostomy now. You should have put a tube inside, and if you don't, put it from outside, save your patient. But nobody will let you do all those things. You will be supervised all the time. Endotracheal intubation must be done. You know, sometime what the new learner does, endotracheal intubation into esophagus. That you should be careful about. Endotracheal intubation into esophagus. So learn and then put into trachea. It can happen for a new learner. Anyway, what is the next thing? Next thing is actually this question. Which one? Relaxer. Relaxer, I know. You know. Tell me the answer then. Relaxer, I think posterior part. Posterior part of what? Yes. Thyroid adenoid? Yes, correct. If that is a relaxer, then what is cricothyroid? It's a tensor of vocal cord. And what is the posterior cricoid? It is a safety muscle of larynx abductor, the only abductor of the vocal cord. And lateral cricoid, the adductor of the vocal cord. So we'll keep our answer thyroarytenoid. Yes, thyroarytenoid, but the posterior part of thyroarytenoid. Okay, what about this? Tensor of vocal cord along with anterior part of thyroarytenoid. And this one is the safety muscle of larynx, abductor of vocal cord. This one, the adductor of the vocal cord. Okay, we'll keep this answer. Yes, you have to keep that answer. And then what is the answer to this question? I am doing thyroidectomy, and by mistake I have damaged the external laryngeal nerve, and one muscle is paralyzed. Which one? Cricothyroid muscle. So what is the problem? Weak voice. There will be a weak voice. Why there will be a weakness of voice? Because you have paralyzed this muscle. Which one? External laryngeal nerve supply only one muscle of larynx, cricothyroid muscle. So tension of vocal cord is compromised, and when the tension of vocal cord is compromised, there will be weakness of voice. Your voice become weak. So that is the answer. Yes. Okay, fine. Let us look at the removal of thyroid then, and how to prevent injury to the external laryngeal nerve. And we are removing the thyroid now. So you're removing the thyroid, but then you have to ligate the arteries, thyroid arteries. When you're ligating the thyroid arteries, be careful. Don't include the nerve into your ligator. Which nerve? Which artery? So you're removing the thyroid, you have to ligate the superior thyroid artery. And superior thyroid artery, which is the first branch of the external carotid artery supplying the thyroid gland, is followed by the external laryngeal nerve. So external laryngeal nerve is at a risk of injury when you are ligating the superior thyroid artery. External laryngeal nerve is a branch of superior laryngeal nerve, and superior laryngeal nerve is a branch of vagus nerve. So vagus nerve gave you the superior laryngeal nerve. Yes. Gave the external laryngeal nerve. Yes. And external laryngeal nerve is damaged now. Yes, actually. When I was ligating superior thyroid artery, I have damaged the external laryngeal nerve included in my ligature. So one muscle was paralyzed. Name is cricothyroid, which is anteriormost muscle of the larynx, which is tensor of the vocal cord. So there was a weakness of the voice. That is a problem. So where should I ligate? That is the question. Actually, superior thyroid artery should be ligated as close as possible to the thyroid gland. Why? Superior thyroid artery should be ligated as close as possible to the thyroid gland. But why? Because that time the external laryngeal nerve would have already supplied cricothyroid muscle and the artery will be coming towards the thyroid gland. Then you ligate it. Means they will separate now. Yes, they are coming close, So artery and nerve are coming close. Yes. So you just want to let the nerve supply the muscle. Yes. And after that you will ligate the artery. Yes. And that time the artery will be very close to the gland. Yes. You have to ligate superior thyroid artery as close as possible to the gland to avoid injury to a nerve which is supposed to supply this muscle, cricothyroid muscle. Otherwise, if I am ligating it away, if you are ligating it away, then see, if you ligate the artery away from the gland, then you will include the nerve, might include the nerve and damage the nerve. Okay, fine. What about the inferior thyroid artery branch of thyrocervical trunk supplying thyroid gland? When you say inferior thyroid artery branch of the thyrocervical trunk supplying thyroid gland, it is accompanied by recurrent laryngeal nerve. So it is supplying the recurrent laryngeal nerve. So it is also supplying the inferior, it is supplying the parathyroid glands also. You are telling inferior thyroid artery is the major artery to parathyroid gland? Yes. Inferior thyroid artery is the major artery to parathyroid gland and it is also supplying the recurrent laryngeal nerve. So what is the information? Information is you have to let the inferior thyroid artery supply recurrent laryngeal nerve and parathyroid gland, and then the artery will be very close to the thyroid gland and then you ligate the artery. Actually, there's an old story and there's a new story. So old story is old, it's gone, don't follow that. Then what is the new story? This is the new story. You have to ligate this artery as close as possible to thyroid gland. Why? Because if you ligate this artery away from the thyroid gland, then be ready for two structure ischemia. That will be ischemia of recurrent laryngeal nerve and ischemia of parathyroid gland. Okay, you are trying to say, may it be inferior thyroid artery or may it be superior thyroid artery, both of them should be ligated as close as possible to gland due to some different reasons. Yeah, maybe the reasons are different, but both the arteries should be ligated as close as possible to gland. Inferior thyroid artery should be supplying recurrent laryngeal nerve and should have supplied parathyroid gland, then it would have come very close to the gland, then you have to ligate and then remove the thyroid gland. Be careful. This is one diagram which is telling you some other story. What is the other story? Remember, vagus nerve. Yes, remember, vagus nerve is giving superior laryngeal nerve and recurrent laryngeal nerve and both sides. Now, when the vagus nerve is giving superior laryngeal nerve and recurrent laryngeal nerve both sides, left recurrent laryngeal nerve is longer and coming back to supply the larynx. You are telling the left recurrent laryngeal nerve is longer and coming back to supply. That is why it is called recurrent. Yes, that's why recurrent. So recurrent laryngeal nerve is making a loop under arch of aorta and hooking under the ligamentum arteriosum attaching to arch of aorta. You are telling that this is left-sided recurrent laryngeal nerve here. Yeah, this is left-sided recurrent laryngeal nerve and it is hooking under the arch of aorta, hooking under some ligamentum arteriosum there. Yes, ligamentum arteriosum, the adult remnant of the ductus arteriosus. So ductus arteriosus, adult remnant, ligamentum arteriosum, and it is hooking under that arch of aorta, ligamentum arteriosum to go back into tracheoesophageal groove. Yes, tracheoesophageal groove, you remember? Then it has to supply the larynx muscle and vocal cord below the, it has to supply larynx mucosa below the vocal cord. So it will supply most of the larynx muscle and the laryngeal mucosa below the vocal cord. See the difference between the left and right. Right is hooking under subclavian artery to supply the larynx. So right recurrent laryngeal nerve is short length, stays in the neck region only. Right recurrent laryngeal nerve is short length and stays in the neck region. Do not enter the thorax. Hook under the subclavian artery in the neck region and run in the tracheoesophageal groove and supply the larynx muscle and the larynx mucosa below the vocal cord. See the difference. The left recurrent laryngeal nerve is entering thorax and coming back from the thorax, but the right remains in the neck region only. Let's draw the diagram now. So you want to draw the same diagram? Yes. Okay, fine. You're talking about the right-sided vagus nerve now? Yes, right vagus and also the left vagus. So you're looking at right and left vagus. What are they doing? What they're doing, they are going down and they are giving some branches to larynx. Which branches to larynx? This is the larynx. This is the vocal cord of larynx. Tell me, who is supplying the laryngeal mucosa of the larynx? Above the vocal cord, below the vocal cord. So this is the right vagus going down and that is the left vagus going down, and you are talking about the vagus supplying laryngeal mucosa. Which branch will supply laryngeal mucosa above the vocal cord? And which branch will supply laryngeal mucosa below the vocal cord? That is what we have to discuss now. And how will you discuss? Actually, you know, the vagus would have given branch. What? The vagus would have given the branch superior laryngeal nerve, branch of vagus, and recurrent laryngeal nerve, branch of vagus. So on the right side, this is hooking under some artery. What is that artery? Right-sided subclavian artery. And what is it doing on the left side? See, vagus nerve is giving superior laryngeal nerve on the right side, recurrent laryngeal nerve on the right side. Right recurrent laryngeal nerve is short length and hooking under right subclavian artery, remaining in the neck region. Now, if you say it is remaining in the neck region, then who is entering the thorax region by passing thoracic outlet or inlet? Who is passing thoracic outlet or inlet? Some books say thoracic inlet, some will say outlet, because if structure enter, inlet, if structure exit, outlet, whatever. So thoracic inlet or outlet, whatever. Neck and thorax boundary. Who is entering the thorax then? The left side. Can you show the left side recurrent nerve entering thorax then? Let us see, but first you have to tell. The superior laryngeal nerve is the nerve of the fourth arch, and the recurrent laryngeal nerve is the nerve of the sixth arch. So most of the larynx muscle develop in the sixth arch. Then, so most of the larynx muscle supplied by recurrent laryngeal nerve, except one which develop in the fourth arch. So you're telling that the superior laryngeal nerve is a branch of the vagus nerve, is the nerve of fourth arch, yes, and recurrent laryngeal nerve, which is a branch of the vagus nerve, is the nerve of sixth arch, supplying most of the larynx muscle except one. Which one? The cricothyroid, tensor of vocal cord. If you say cricothyroid muscle, the tensor of the vocal cord, it was developing in the fourth arch, is supplied by a branch of superior laryngeal nerve, name external laryngeal nerve. Remember? So cricothyroid muscle is the only muscle of larynx which will develop in the fourth arch. Is a tensor of vocal cord, is supplied by a branch of the superior laryngeal nerve, name external laryngeal nerve. Can we see the external laryngeal nerve now? Yes, why not? Let us see. See, superior laryngeal nerve is dividing into two now. Name internal laryngeal nerve and external laryngeal nerve. So what is this internal external laryngeal nerve doing? Actually, the external laryngeal nerve, internal laryngeal nerve are branches of superior laryngeal nerve. Yes, that we can see. Now, internal laryngeal nerve go inside the larynx and supply vocal. It is supplying the laryngeal mucosa till the upper surface of the vocal cord. So you're telling that superior laryngeal nerve gives some internal laryngeal nerve and external laryngeal nerve. Internal laryngeal nerve going inside the larynx and external laryngeal nerve going outside the larynx. Yes. And internal laryngeal nerve, which is going inside the larynx, is supplying laryngeal mucosa till the upper surface of the vocal cord. Yes. Then who is supplying lower surface of vocal cord? If it's a lower surface of the vocal cord and below the vocal cord, then it will be recurrent laryngeal nerve. Recurrent laryngeal nerve? Yes. Okay. So upper surface of vocal cord and above the vocal cord is the internal laryngeal nerve, branch of the superior laryngeal nerve. Branch of vagus? Yes. And lower surface, inferior surface of vocal cord and vocal cord below the The laryngeal mucosa below the vocal cord is by the recurrent nerve? Yes. And sometime they'll ask you question like, who is supplying vocal cord? Then I'll say both, but there's only one answer to be given. Which one will you give? So what is the question? Question is asking laryngeal mucosa on the vocal cord is supplied by, and you will tell both the answer, interlaryngeal plus recurrent. But you have to give only one answer. Which one will you choose? If you have to really choose between the two, then you say interlaryngeal nerves, because some books say internal laryngeal nerves supply laryngeal mucosa till the vocal cord, maybe superior surface or maybe inferior surface. That is your second choice of answer. Mean to say, see, vagus nerve gave you superior laryngeal nerve? Yes. Gave you internal laryngeal nerve? Yes. Supply the laryngeal mucosa till the vocal cord. Maybe superior surface, maybe inferior surface, is written by some book. So which one will you believe? I told you what to believe first. Upper surface, interlaryngeal. Lower surface, recurrent. And if not possible, then both the surfaces, interlaryngeal. Okay, if you say so. You were talking about external laryngeal nerve. What is it doing? External laryngeal nerve is the one which is supplying the external muscle. Which one? Cricothyroid muscle, tensor of vocal cord. Oh, this muscle? Yes. Okay, cricothyroid muscle. Fine. Tensor of vocal cord. So, what is the problem? Problem is, I was removing the thyroid gland and I was ligating the superior thyroid artery, yes, and I have damaged the nerve. Why? Because I did not take care to ligate this artery as close as possible to the gland. It should be ligated as close as possible to thyroid gland. So you did not do that. No, you were ligating away. Yes. So what happened? When I was ligating superior thyroid artery away from the gland, I have included this external laryngeal nerve, and this muscle was paralyzed, and there's a weakness of the voice. Okay, what about the other one? Other one, you have to be careful that this inferior thyroid artery, yes, should be ligated, yes, as close as possible to the gland. Again, why? Because inferior thyroid artery is supposed to supply what? Two structures. What is that? Before supplying the thyroid, it has to supply two structures, that is recurrent laryngeal nerve and also the parathyroid gland. Actually, the chief artery to parathyroid gland is inferior thyroid artery. So if you have ligated inferior thyroid artery away from the gland, be ready for ischemia to the parathyroid gland and also recurrent laryngeal nerve. What will happen when recurrent laryngeal nerve is not working? If recurrent laryngeal nerve is having ischemia, yes. If recurrent laryngeal nerve is having ischemia, almost all the larynx muscle will be paralyzed. So when there's a ischemia to the recurrent laryngeal nerve, almost all the larynx muscle will be paralyzed, and also there will be laryngeal anesthesia below the vocal cord. Laryngeal anesthesia below the vocal cord. If recurrent laryngeal nerve is gone. What about the left recurrent laryngeal nerve? Left recurrent laryngeal. I'll tell you. This is the left recurrent laryngeal nerve now, and this left recurrent laryngeal nerve is hooking under the arch of aorta. You are telling that this is left vagus? Yes. Giving superior laryngeal nerve? Yes. And this is the recurrent laryngeal nerve? Yes. Now this left recurrent laryngeal nerve branch of the vagus nerve is hooking under the arch of aorta, yes, and coming back towards the larynx, yes, because it has to supply larynx, recurrent laryngeal, going into tracheo-esophageal groove, yes, tracheo-esophageal groove, supply larynx, and it is hooking under the arch of aorta, and embryologically that is happening, and it is also hooking under what is called ligamentum arteriosum. And ligamentum arteriosum is a remnant of the ductus arteriosus. What is the importance of doing that? Importance is this artery passing the thoracic inlet 2 times. So when there is a thoracic inlet syndrome, it will be gone. Oh, thoracic inlet syndrome. Yes. Which nerve is gone? Right or left? Right remains in the neck region. It is not exiting thorax. So right recurrent laryngeal nerve remains in the neck region, do not exit the thorax? No. So it is the left recurrent laryngeal nerve which is exiting the thorax? Yes. So it can be involved in thoracic inlet syndrome because it is passing 2 times there. Yes, you see, 2 times.